Hi everyone, my name is Carl Smith. I've just taken over to clinical lead for Hertfordshire and West Essex. All clinical leads also have a portfolio, and mine moving forward is going to be the cardiac portfolio. So my plan over the next few months really is just to do bite-sized video clips just around anything cardiac related. And today we're going to look at inotropic support for the ROSC patient using adrenaline. Our usual format for adrenaline comes in adrenaline 1 in 1000, which are the small vials which we use for patients in anaphylactic shock. And then we have the adrenaline 1 in 10,000, which is used in a cardiac arrest situation. If you get a patient that then comes out of cardiac arrest and you get return of spontaneous circulation, who is hypotensive, we will need to manage that. Initially, we were going to try some fluid therapy. So we're not going to go straight into adrenaline. So we'll try some fluid therapy. So the amount of fluid you need to give is around or up to 1 litre. I can't say exactly how much you need to give, but what I would say is always try a fluid challenge first, because there may not be the need to give adrenaline 1 in 100,000. Recent guidelines have come out to state that we should be aiming for a blood pressure systolic of around 100. That's different to the 90 that we used to aim for to perfuse our vital organs. So if you try some fluid and the blood pressure hasn't come up, as I said, we're aiming for around 100 systolic. I'll show you how to go on to draw up some adrenaline 1 in 100,000. So you need to take out an adrenaline 1 in 10,000, the one we use for cardiac arrest. You're going to need your syringe and you're going to need a 3-way tap. So we're going to take this out and check it. It's always best to challenge a response with drug checking rather than confirming, is this adrenaline? Say to your colleague, what is this drug and when does it go out of date? So that removes the confirmation bias. We're then going to get the 3-way tap and take off the 2 white caps. And then you want to make sure that your 3-way tap is in the position that you need it. So you want to make sure that we're going to be going into there and coming out of here. So I'm going to just connect the adrenaline. So your adrenaline 1 in 10,000 will be connected to there. And you're then going to connect your syringe onto here. And we're going to push 1 ml of your adrenaline from the adrenaline syringe into your normal syringe. Once you've done that, you're going to disconnect that, and then you're going to connect a drawing up needle, and then we're going to get some sodium chloride to draw into the syringe as well. You're going to draw up 9 ml of this into the syringe. So you're going to have 9 ml of sodium chloride and 1 ml of adrenaline. So you're going to have 10 ml in total. So once you've got your 9 ml of sodium chloride and your 1 ml of adrenaline, you then need to ensure that you label it. It's really important that you write down, you get the correct drug and how many, what your drug dosage is per mil. So this is going to be 10 micrograms per mil. I'm going to talk now about presentation of adrenaline in this pre-filled syringe. So you have 1 milligram of the drug in 10 mils. So 10 mils of the fluid, 1 milligram of adrenaline, or 1,000 micrograms. 1 milligram and 1,000 micrograms are exactly the same thing. What we're going to do for inotropic support is we're going to take out 1 ml of that adrenaline and put it into our syringe. We're then going to use 9 ml of sodium chloride, and it's going to make it 10 ml of fluids. And within that then, we're going to have 100 micrograms of the drug in 10 ml. So 100 micrograms in 10 ml, and we're going to give 1 to 2 ml at a time. So that will be 10 to 20 micrograms every 3 to 5 minutes. So when we first introduced adrenaline for post-ROSC management, we asked everybody to contact clinical advice prior to giving adrenaline to bring up the blood pressure. Now we're happy that if you're an HCPC registered paramedic, you've read the updated clinical instruction, you feel that you're confident and competent, and you've watched and understood this video, we're more than happy for you to go ahead and just give the adrenaline without contacting clinical advice. However, if you need some support, there's clinical advice is always available to you, or you can contact CCD on 202 on your radio, and they will always be happy to discuss your case and give you some support where needed.